Thank you all for joining us today for Aquifer for new clerkship and program directors. My name is Megan Hotelling, and I'm the Community Engagement and Events Manager for Aquifer. If you're just logging in, we would love for you to go ahead and utilize the chat and introduce yourself and let us know where you're logging in from today. Before we get started with the webinar, let me give you some background on Aquifer. Founded in 2006, Aquifer is a mission-driven nonprofit with a mission to deliver the best healthcare education through collaborative development and research into innovative, high-impact virtual teaching and learning methods. Now, before I go any further, I would love to get a sense of our audience today and the experience that you have with Aquifer. So I'm going to go ahead and load up a poll for all of you to answer. Let's see if we can spotlight it. Okay, so the first question we have for you today is, have you personally used Aquifer as an educator? We'd love to get a sense of our audience and if you've utilized any of our learning tools or cases. Poll results coming in. It's always exciting to see how many people have used, but also really exciting to know that there are people in the audience who have not used, because we do love to talk about Aquifer. Give it another second. Okay. Perfect. Thank you so much. So 65% of us, yes, have used Aquifer, while 35% have not. We hope although those of you who have not used it learn a lot today, and those of you who have learn a little bit more. All right, let's keep going. The heart of trying to reach this mission is the Aquifer Consortium. The consortium brings together volunteer expert medical and health professions educators from across the country in various disciplines, health professions educators just like you. They collaborate to innovate, create the highest quality content, and ensure that Aquifer's pedagogy, learning tools, and assessments support best practices in teaching and learning. These experts also work diligently to keep our content up to date and accurate. You can trust that our content has been developed and maintained by people that are committed to the best educational experience for students. And I'm pleased to introduce two of those people today. Cindy Lord has been an educator for over 3 decades. She served as the founding program director of the Case Western Reserve University PA program and recently retired from Case School of Medicine. Prior to Case Western, she helped develop the Quinnipiac University PA program and served as the program director there until 2015. Cindy is a passionate advocate for oral health integration in health professions education and practice. Cindy has been a volunteer at Aquifer for years and has spearheaded key initiatives, including the PA Task Force and Peer Trainer Board. She was instrumental in developing Aquifer's Anyone Can Coach framework. Dr. Poonam Sharma, MD, is a hospital medicine specialist at Duke University Health System. Dr. Sharma currently serves as the director of Pioneer, an initiative within the Duke School of Medicine. Pioneer is a 16-week course for second-year medical students at Duke University School of Medicine that provides longitudinal ambulatory clinical experiences across multiple specialties. She is actively involved in patient care, holding clinical appointments at Duke University Hospital and Duke Regional Hospital. And if that were not enough, Dr. Sharma is a member of the Peer Trainer Board at Aquifer. The peer trainers are a unique group of volunteers that share their expertise in health professions education and Aquifer to help subscribers get the most out of this platform. And now I'm going to hand it over to Cindy Lord.
Thanks, Megan, and welcome to all our attendees on today's webinar. I'd like to start off today with a brief introduction of the Aquifer learning system. Aquifer takes a holistic approach to the development of teaching and learning tools. The aim is to provide up-to-date and high-quality cases that support learning, along with assessments that allow students and educators to identify strengths and gaps in learning. The clinically relevant cases and assessments are designed to work together to enhance understanding, preparing students not just for exams, but for real-world clinical practice. Next slide. Aquifer cases are peer-reviewed and continually updated by the Aquifer Consortium. Each case flows along like a standard patient encounter, from history, physical, and labs, through developing a differential diagnosis ordering additional studies, forming a final diagnosis, to treating and managing the patient. The cases provide in-depth, interactive, and engaging teaching. And much as you would expect from an expert preceptor, they ask the student questions to check and correct their knowledge before moving on to the next step. Cases include example communication, embedded questions, deep dives, and links to references and more. Next slide. As a clerkship or program director, you envision an outcome where your students develop into competent, confident, and compassionate clinicians. Your aim is to create a learning environment that fosters the development of clinical reasoning with an opportunity to deploy what they're learning in real-world clinical scenarios. It also includes cultivating lifelong learning and the development of adaptive expertise in your students. To accomplish these aims, it's helpful to have aligned assessments and learning resources. As we get into it today, Aquifer's virtual patient cases and assessments are designed to develop clinical reasoning skills in a safe, structured environment. Further, the emphasis on identifying gaps in clinical reasoning, self-directed learning, and reflection with the new formative assessments is designed to catalyze lifelong learning and the development of adaptive expertise. The rest of this webinar will delve into how you can deploy Aquifer to create a learning environment that empowers your students to become the competent, confident, and compassionate clinicians we aim for. So I'm just going to stop for a second to just share a brief story about a student who developed into a competent, confident, and compassionate clinician, and how developing an aspirational learning environment focused on self-directed learning, clinical reasoning, and lifelong learning made a difference to the student and actually to me too. So this was a student who was a very good student. They used and completed their Aquifer cases in their preclinical year and, did the work, appreciated it, but as with most students, sometimes felt it was busy work. They requested some coaching sessions from me before going to clinicals, and because they just wanted to make sure they could glean the most, they were very motivated to get the most out of their clinical rotations. So of course, I recommended that they add 1 or 2 Aquifer cases each week to their workload. And, they had their list of their test questions, their test bank. So, every test bank you can imagine is there. But they graciously said, okay, I think I'll try that. Well, I was really tickled and surprised months later when we were in a meeting, and the student who was doing very well, did very well clinically, shared with myself and some other students that they attributed a lot of their success in clinicals to being able to do those clinical Aquifer cases each week. They felt that the clinical reasoning skills that they developed and their self-directed learning, they did adaptive expertise. They adapted that to the cases they were seeing on the wards. And most interesting, they said that they felt they had a deeper understanding of cases. They, again, could apply those skills. But I found most interesting was they felt that they had richer conversations, deeper conversations with their preceptor, that their colleagues around them said, we had the same rotation, same preceptor, and they did not experience. Well, the student successfully completed the program, took their boards, passed them, and of course, has made me even happier because they're practicing in primary care. I'm a primary care PA. And I was just so excited to hear from them recently, and they said they were getting ready to start precepting and that they are going to require Aquifer cases of all the students that go through their rotation. So just a kind of a story that, sometimes we all need that feedback to know, are we doing the right thing? Do these tools that we present to our students help? And they do. So moving on. So let's go over what we're going to cover today. So we're going to begin by discussing how Calibrate, a formative assessment, can empower students to direct their own learning and help you identify gaps in your curriculum. Next, we'll examine how we can find, assign, and track the completion of cases designed to provide consistent, high-quality learning experience. Throughout the webinar, we'll share best practices, recommendations, and innovative features to help you maximize the impact of Aquifer in your educational programs. Before we get started with formative assessment, we also want to acknowledge that you may want onboarding or an individual meeting to learn more about how you can address your unique goals. If that is the case, do not hesitate to reach out. And now let's get started with formative assessment. So I'm going to kick this off with a quick poll. And the question that we'll have with the poll is, how much emphasis do you currently place on fostering self-directed learning in your program? And just select one of those. And so as the voting is coming in, a great deal, a moderate amount. So a moderate amount and a great deal seem to be getting most of the voting. So people are putting emphasis on self-directed learning, which is great. Cool. All right, so our aim is to prepare students for success, not only during their medical education, but throughout their clinical practice. One way to do this is to foster self-directed learning. Developing self-directed learners is part of current accreditation standards, but our motivation extends beyond mere compliance. Self-directed learning is a necessary component of developing adaptive expertise, the ability to apply knowledge and skills flexibly in novel situations. Medical education and the practice of medicine are evolving rapidly, which means we all need the capacity to take charge of our learning. An effective assessment system is key to facilitate self-directed learning. An assessment that provides feedback on a student's development of clinical competence can be the jumping-off point for identifying areas of improvement and encouraging proactive goal setting. Next slide. Aquifer Calibrate is a powerful formative assessment tool that clerkship directors and program directors can leverage to encourage self-directed learning among their students. By employing the principles of test-enhanced learning and spaced repetition, Calibrate assessments are designed to be assessments for learning rather than simply assessments of learning that we see with these hundreds of test banks that students keep wanting us to purchase. Calibrate helps clinical students drive their own learning by identifying areas of strengths and gaps, as well as exposing blind spots where their confidence and accuracy may be misaligned. This self-awareness is important for developing higher order thinking and problem-solving skills, which are essential for success in clinical practice. For faculty and administrators, Calibrate offers a structured approach to support accreditation standards related to assessment of student learning, feedback, and self-directed learning, such as LCME 9.7 and 6.3 and ARC-PA B4. And I'm sure there are nurse practitioner accreditation standards that this will help meet. The objective data provided by Calibrate assessments can be used to facilitate effective coaching conversations, identify learners who may need additional support or remediation, and pinpoint gaps in the curriculum. Next slide. Currently, there are 4 Calibrate assessments. Radiology has a total of 24 questions and 19 of those are scored. Pediatrics has 37 total questions with 32 being scored. Internal medicine has 41 total questions and 36 are scored. And family med has 45 questions with 40 being scored. Calibrate assessment questions are written by clinicians and validated. They follow a standard board-style approach with a short vignette followed by a single best answer multiple choice question, but with the additional requirement that learners identify their level of certainty in each answer. The certainty rating added a new dimension to assessment results, taking feedback beyond right or wrong answers. It provides a more detailed metacognitive analysis of a student's applied knowledge base and understanding. The assessments are not long to take. So IM and FM take about an hour on average. PEDS usually under 45 minutes, and radiology is the quickest, usually takes about 20 minutes. All 4 Calibrate assessments have been analyzed psychometrically and are statistically reliable and valid. They're easy to administer and they don't need to be proctored, easing the burden on programs. Next slide. Aquifer designed Calibrate so that students take 2 exams, one early and one late in each rotation. The early exam supports in-rotation learning. The late exam prepares for the shelf exam and informs future learning. The formative learning process starts after the initial assessment. Students actively engage in targeted learning based on feedback rather than passive exam cramming. By design, Calibrate is an assessment for learning, avoiding common pitfalls that lead to the exam being viewed as summative. Calibrate aims to empower learner ownership through self-evaluation and reflection. Assessments address national curriculum content for the rotation, and data provides formative feedback to prioritize studying. In a rotation, coaching helps develop personalized learning plans that reinforce strengths and address gaps. Follow-up assessments evaluate progress and impact. Coaching then facilitates the application of insights and continuous improvement. So again, I'm just going to stop for a couple minutes and just share a story about how Calibrate results can facilitate effective conversations with students and how the results result in continuous improvement. So I had a different student, and she was a good student. She was actually an average student in her preclinical phase, and again, asked for some coaching sessions with me because she wanted to get the most out of her clinical rotations, and she was motivated to do that. And so she came to the first session with her learning plan, very developed, very extensive. And as she was developing it for each rotation, each month, it was getting longer and longer and more burdensome. And I said, I'm not sure how you're going to get through all of this. And her topics were there, but they were very broad. I'm going to study art of cardiology. And in the PA world, on our board exam, there's over 60 topics in cardiology. So imagine that. And then she adds gastro, and then she adds ENT, then she adds peds. So it was just getting really bulky. So we were doing the beta testing for Calibrate at the time, and I convinced her to become a beta test student, and she did. And she got those results back. And what happened was she became much more focused and efficient in her learning plan. She was good at developing a learning plan and she followed through on it, but it was just so ginormous in general. And using her Calibrate results, she was able to see, you don't see the answer to the question, but she was able to see the actual learning objective of something that she didn't get right. So she found her gaps because she saw her gap analysis, and then she could see the learning objective. She could go to the case and actually pinpoint in that case. So instead of saying, I don't know heart failure, she could go into that case and say, oh, it was the physical findings that I wasn't correlating well to the rest of the diagnosis. So it helped her become more efficient and more focused in her learning plans. She was very successful in her clinical year. She actually she blossomed. She had a great clinical year, passed her boards, and she's now successfully practicing in emergency medicine. So I think it was a good success story. So we're going to do another quick poll. And we're going to do a check-in with which aspect of Calibrate do you find most valuable? So select one of those choices. And let's see. So we have a lot of voting for supporting in-rotation learning, which is great. And then, preparing for the shelf exam, providing formative feedback. So we're really it's all over. We've got a lot of, and facilitating personalized learning. So that's great because all of those things are valuable, right? We don't just want to prepare for that rotation. We certainly just don't want to prepare for a shelf exam, but it's really for that lifelong learning. So that's great. All right, so let's move on. Our next slide. So if you want advice on getting started with Calibrate, check out the Aquifer blog, Implementing Calibrate Formative Assessment, Advice from an Early Adopter by Ann Walsh. Ann gives practical advice about getting started. Included in that advice is how to use Calibrate as a reflection tool. And I believe if you go into the chat, we will we'll post the link to that blog. Otherwise, you can go to aquifer.org, go to resources, scroll down, you'll see the blogs, and then you can find Ann's blog. It's a really well done blog. She's a PA, but it applies to all professions. Well done on how to get yourself started. All right, next slide. So now I just want to briefly discuss how students and your program can get the most out of Calibrate. So after a student takes their assessment, they immediately receive their results, which includes an overall performance report informing them how prepared they are for the clerkship. They also get detailed data on how they performed. This includes data broken down by system, decision type, and how they performed on that item. The key is that they use this information for self-assessment. Remember, Calibrate is intended as an assessment for learning. You want to assess of learning, do 1 million test questions, which they do already. In other words, the data is there to empower the student. Next slide. With that in mind, Aquifer has included a scaffolded individual learning plan tool, which is built directly into the platform. The student can reflect on their performance, identify next steps, and even create a to-do list of relevant cases. Importantly, they can share that plan with you. This gives information for learning-focused mid-rotation feedback conversations. So I'm going to, one more time, stop and share a story about a mid-clerkship feedback and how it could be improved by having this kind of information. So a student who actually struggled in their preclinical year came to me, wanted coaching on how to prepare for clinicals, came with their learning plan was test questions. Here's the test banks I'm going to use. Here are the study books I have, or, here are the clerkship books I have, but very general, not much there. Really, as time went on, he did a couple rotations, did not do well with his end of rotation exams, came back to me, kind of skipped out, came back to me, and I said, look, let's try using Calibrate and the individual learning plan. And what it did for him was, overall, it built his confidence because he became more efficient, more focused, and more effective. Because with the individual plan, instead of saying, I'm doing all these test questions in cardiology, he actually had to have a strategy. He had to actually put what the step was going to be. And then for him, actually had to put accountability, which was one of the areas where he found that he wasn't holding himself accountable. So overall, it gave him confidence because he was focused in his learning plan now. And he was successful with that. He went on to pass all the rest of his shelf exams. So I would say focus, effectiveness, efficiency, and confidence. Okay, next slide. So now that we've discussed the importance of self-directed learning and how Aquifer Calibrate can support it, let's address another important topic in health professions education, and that is providing consistent and high-quality learning experiences. I'd now like to invite my colleague Poonam to talk about how you might use Aquifer to address this challenge. Poonam, it's all yours.
Thanks, Cindy. That was great. I always learn so much listening from you, so I appreciate all of those tips. To everyone else on the webinar, thank you for joining today. It's great to be with this community of folks. And if you are indeed a new clerkship director or program director, congratulations. It is a great way to shape the future of healthcare delivery. So kudos to you on all you have achieved and will be doing moving forward. When we were planning this talk, we thought it would be good to think of a challenge that we've faced and that Aquifer has helped us navigate. And of course, COVID comes to mind as a time that the rate of change was just out of control. I think anytime in medical education, you have to deal with the fact that it's hard to make sure that every single student is going to see every clinical case you would like them to see, whether you're in the inpatient setting or in the outpatient setting. And so pneumonia is one of the core diagnoses we hope that all of our students will see in the inpatient setting. And when COVID happened, we had more cases of pneumonia than we had ever hoped to have in the hospital. And yet suddenly our students were not allowed to see any patients with pneumonia. So knowing that we had this resource where we could have the students still access content and work through cases and ensure that the students had exposure to pneumonia was a really crucial thing for us to rely on. And that principle of having core information available to all of our students, no matter what team they happen to be on or what site they're rotating at, remains an essential foundation for us as we plan our clinical activities for our students. As a clerkship or program director, I think we all aim, regardless of setting, for students to receive a standardized, comprehensive educational experience. It's necessary for accreditation, and it also helps prepare our students to become competent and confident clinicians who will be taking care of us in the future. Aquifer is a vital resource for ensuring curriculum consistency. The courses are aligned with national curricula, so they cover the content that clinical rotations are expected to teach students. One advantage is when you incorporate Aquifer cases into your curriculum, you can trust that the case materials are designed to align with national standards and are reviewed by experts on a regular basis. And I think that's a really key thing. Certainly at our institution, we have some homegrown things, which are also great. And it also is a lot of work to make sure they're regularly updated and that you're keeping on top of all of the materials you offer. And so knowing that using Aquifer, you have slew of experts in your back pocket who are regularly reviewing the cases and make sure that the content is up to date is a real asset. Aquifer has material beyond the core clerkship material as well, including over 50 cases focused on clinical excellence topics and over 40 integrated illness scripts focused on cognitive integration of basic sciences into clinical reasoning. There's a simple search tool called the Content Library, so it's simple to locate the material you need and quickly assign it to students. Next slide. One of the key strengths of Aquifer is that the cases are closely aligned with the national curricula. The case writers are medical educators themselves, like us, and they're involved with other national groups, and the content aligns with national expectations. As Megan mentioned in the beginning, the content's developed by people doing the same work as you, caring for patients, teaching learners, so the writers understand the essential knowledge and skills that students need to acquire during their educational experiences. This ensures that the cases cover the most relevant and important topics, providing a solid foundation for students' learning. The result is we can be confident the students are receiving high-quality, peer-reviewed content that aligns with the national standards. The alignment helps standardize educational experiences across rotation sites and ensures that all students are exposed to the core concepts and principles that you really want to ensure that they have exposure to. Going back to the pneumonia example, it's impossible for me to guarantee that any particular team is going to have a patient with pneumonia during their clerkship, but I can deploy an Aquifer case and ensure all students are given the opportunity to learn the content despite the unpredictability of what goes on in a clinic or in a hospital. Of course, this is good for student learning and patient care, and also good for when you're trying to meet your accreditation standards or when I have to stand in front of curriculum committee and tell them about my course over the last year. Next slide. Since Aquifer has over 200 cases, including family medicine cases, pediatrics, internal medicine, urology, radiology, geriatrics, and clinical excellence, there's usually something to address what you specifically need. There are going to be times you want to ensure students have resource for a particular type of content. The search tool allows you to find cases by keyword or searching by diagnosis. So here you see an example of a search where we found an internal medicine case focused on a patient who shows up in the ED with shortness of breath and cough and fatigue. And it turns out there's an illness script which can help with the cognitive integration of basic sciences with the clinical practice. By assigning the cases, you ensure that all students have the opportunity to learn about these important conditions, regardless of what patients are in clinic that day. So there are a lot of ways to approach this. So you may want to focus on a specific case that covers a condition or situation that all the students will have to know, such as well-child checks. And actually recently our students have been asking for more content about well-child checks. So it's nice to have this as a resource. There's some clinical excellence cases, high-value care. Perhaps your institution is trying to add more high-value care content. So this can be a nice go-to resource. Or oral presentation cases, which is obviously such a foundational skill for health profession students. These cases provide students with an opportunity to practice their skills in a virtual setting so they can get reinforcement on the importance of these topics in a safe environment. So you may be wondering, once I have these cases that I want picked out, how do I assign them to students? So next slide, please. In Aquifer, you can create custom courses that are tailored to your clerkship. So once you pick out the cases that you believe meet your learners' needs, you can bundle those into a custom course and assign them to the students in a cohort. It's a little bit of upfront work, but it's totally worth it. And if you have a coordinator that's working with you on the course, then this is something that they can help with. I think we have some coordinators on with us today, so great teamwork here. When you assign a custom course to your students, it appears in their to-do list. So that's a really nice feature for the students because it makes that easy for them to access the material and complete the assigned cases. By assigning custom courses, you can ensure that all students receive the same carefully curated content that you want them to receive, regardless of what site they're doing their rotation at. This helps to standardize the learning experience and ensures students have the opportunity to acquire the knowledge and skills you deem essential for the clerkship. The custom courses can be duplicated, so the students who are on the rotation next block can have the similar resources. So it's a little bit of upfront work, but it's totally worth it as the rotations go by. Creating custom courses for each cohort of students is helpful in keeping track of completion as well. Next slide, please. So we talked about how creating the custom courses is nice from a student perspective because then it pops up on their to-do list. But as a clerkship or program director, it's also great because then you can check out this dashboard and see what your students are doing. See if they're actively engaged in their learning and completing the required experiences. This is the report called the course report, and it allows you to easily keep track of their completion at a glance. And it lets you identify early any students who may be having trouble and work with them to figure out a plan. So what's the plan going to be if they are having trouble? Last week, Aquifer had a webinar on getting the most out of the platform for remediation. So I'm not going to go too deep into that, but it is recorded and available, and I recommend it highly as a resource. During that webinar, our fearless leader of the Peer Trainer Board, Kim Tartaglia, and Cindy Lord, who's with us today, talked about using this framework for diagnosing and remediating learner difficulty centered around the core competencies from the ACGME in residency. Next slide, please. The competencies include medical knowledge, patient care, interpersonal and communication skills, professionalism, practice-based learning and improvement, and system-based practice. These are some of the common domains learners need help in. This book that they recommended last week provides detailed examples of the types of problems learners encounter in each of these areas. For example, extraneous information in their clinical notes, they're ordering too many tasks, struggling to prioritize differential diagnoses. Each of these issues can be addressed with targeted remediation strategies that align nicely with the Aquifer resources. The Aquifer cases can help fill in knowledge gaps, improve clinical skills, develop clinical reasoning. They can also assist with competencies outside of patient care and medical knowledge, and I'll go over a couple examples in a moment here. We can also put the handout from last week's webinar in the chat to list some examples. And I think Megan has already put the link in the chat for the webinar, so thank you, Megan. Next slide, please. So one pearl from that webinar was the Aquifer Oral Presentation Skills course, which offers free materials and exercises designed to develop essential oral presentation skills for healthcare providers. This course emphasizes the importance of communication and quality patient care and helps learners present their cases effectively, showcasing their clinical thought processes and skills. One thing I learned from this webinar last week was about a study published in Academic Pediatrics that showed this course to be as effective as in-person teaching at enhancing learners' ability to convey complex information clearly and confidently, which I think is a pretty astounding testament, especially when you can't always be there in person at the learner's side to provide that coaching. Next slide. The Radiology 18 module on professionalism in radiology is designed to help medical students develop essential professional attributes and correctly communicate critical findings, emphasizing its use for remediating lapses in professionalism by reinforcing the importance of integrity, patient privacy, and ethical behavior. There are many more examples mentioned in the handout and the webinar from last week, so check it out. Next slide. Before we open things up to questions, which we'll do here shortly, I think it's worth drawing your attention to a couple of features in the student view. You may be wondering when students log in, what are they going to see? Certainly, you'll hear questions from them, so it's nice to have some visibility of that. First on the screen is the student view of their landing page. As I recommended earlier, when you create a custom course and assign it to a student, it'll show up as an assignment for the student. That's in the upper right of this image. Cases from that assignment show up in their to-do list as well. The students can add other cases to their to-do list. And probably Aquifer is the one assignment I've given students where they have, in fact, looked up other cases and added them to their to-do list and then come back and told me how valuable that content was, which I was super impressed by. Next slide, please. Second, students also have access to a patient library, so it allows them to look for content they want to review. Importantly, the student doesn't know the final diagnosis of the patient when they search for the patient library, so they have opportunity to think through it themselves, but they do see the presenting problem, body system, and some other metadata. A highly motivated and self-directed student could find clinical cases to address their knowledge gaps or extend their knowledge further. Next slide, please. Third, the students receive the lion's share of the data from any assessment assigned. Cindy mentioned earlier, Calibrate is designed to encourage self-directed learning, so it makes sense that the student is getting the bulk of the data to analyze. Next slide. I think this is pretty cool. Aquifer's summary statements provide a unique opportunity for meaningful formative feedback, and you should encourage your students to use it. In about a third of the cases, students write brief summary statements. The summary statements require students to synthesize patient information, so it serves as a proxy for clinical reasoning skills. Using Aquifer's reporting features, you can compare student summaries to expert examples, so it's easier to assess their work and provide targeted feedback. Regularly reviewing these statements helps you understand if students are engaging with the material and if they're developing critical thinking skills. You've seen a couple of examples now. Next slide. I feel like it's hard not to get excited about AI these days, and I think this is a really nice example of how it can be done well. So now when students enter their summary statements, they receive feedback from AI. The AI uses a validated rubric and expert summary statement written by the case author to evaluate the student's submission. The student's response has also been favorable. So it's not just me excited about AI, the students are liking it too. Next slide. So some final recommendations. First, orient the students and set clear expectations. If you take the time to explain the purpose, highlight how this aligns with course objectives and how Aquifer is supporting their learning, it definitely pays off. Be clear about your expectations, including the number of cases to be completed, deadlines, and how their progress is going to be monitored and assessed. By setting clear expectations from the outset, you can help the students understand the importance of engaging with the platform and taking ownership of their learning, which is such an important lifelong skill. 2, explain the purpose of the cases. The cases nicely complement the clinical experiences that you're going to encounter and provide exposure to a variety of conditions. Share with students that the cases are designed to help them develop their clinical reasoning skills. Third, monitor student progress. Regular monitoring of student progress is important for identifying areas where additional support may be needed. You can include information from the reports and feedback conversations, including for me and clerkship review. Students should be encouraged to develop self-monitoring skills, and Calibrate can be a wonderful resource for that. Fourth, invest in faculty development. And I'll be honest, I feel like for a while I was reticent to provide my faculty with additional information about Aquifer because I just felt like they were too busy. But we had some faculty who are consistently asking for more information and resources. And so we kind of opened the gate and said, okay, this is out there. And I was astounded by the amount of traction that got and how some faculty really wanted to do a deep dive and incorporate some of these cases into their content, and either in clinic or that they're going to assign to students and then circle back with them later. So faculty are busy, but it's important to provide faculty development opportunities. You can train faculty on the basics of the platform and then help them find cases or let them learn about additional tools like integrated illness scripts and some of the educator tools. Remember, Aquifer has training staff, and there's a team of volunteer health professions educators like me and Cindy who can help and develop with you and attend some trainings. Next slide. So I think with that, we've opened it up for questions.
I haven't seen any come through yet, but I just wanted to say this. I work at Aquifer and I learn something every time I am on these webinars. So thank you both very much. The information has been super helpful. One of the things that I was thinking of as I was watching this is you provided us with a lot of information. Aquifer is really rich with content and tools for our students. As someone who might be brand new to a role of program director or clerkship director, what tips would you give them just to get started? Because sometimes the hardest thing is just getting started.
Yes, that is great. So I'll kick us off maybe with my thoughts, and then I'll punt it over to you, Cindy, because you're share my thoughts on it too. Honestly, I feel like when you're just getting started in a role, director or program director, there's so much to learn, but it's such a great time to really do this deeper dive and figure out all the tools that are at your disposal, Aquifer being a huge one of those. And taking the time to learn about Calibrate and the ways you can deploy Aquifer now really pays off in terms of making your life easier and your learning experience for your learners richer downstream. Cindy, do you have other?
So I always say, it's like starting new medication, start low, go slow. So go to whatever. So if you're a pediatrics clerkship director, go to the peds cases, just look at them. You can, what's nice for your view, which is ungated. So the students have a gated view. They have to go step by step. You can see the case title, and on the side, you can see the synopsis, the learning objectives. You can see the title. So you go through.
Uh-oh. Cindy, I think your internet may have frozen.
I think it did freeze, but I will say I've heard Cindy before, and she is the master of Aquifer cases. She always knows how to find the content she needs. And I've also heard her say before, just knowing deeply a few cases that are really resonant with you and the educational experience you're trying to provide your learners can really pay off as well. So don't be overwhelmed by all the content that is out there, because there is so much and it's growing all the time with the addition of more neuro and OB and behavioral health cases, which I'm very much looking forward to, but don't feel like you need to know it all right at this moment.
That's excellent. Thank you, Poonam, for picking up. Hopefully Cindy's internet will come back for us. We did have a question in the chat. Michael said, I'm in charge of a surgery clerkship. How does this apply to my students?
That is an awesome question. I don't think we have surgery cases, but I wonder if that would be a good one to sign up for a peer trainer session, and we could kind of delve into some different options and explore with you what's out there and what might align with any gaps that you are dealing with now.
Absolutely. I will pop the link to the curricular consults into the chat for anybody who's interested in meeting with an Aquifer staff person or a peer trainer like Dr. Sharma. And they'll be happy to dive deeper into your specific needs.
And we do have both physician and NP and PA peer trainers. And so so I think it's great that we have the whole spectrum, and often someone who's in one of those professions can join if that's going to be of particularly interest. But I quite like joining across the professions as well.
I love that. To answer Faye's question, I've been to several Aquifer Calibrate webinars, and this one, it was still very informative. Will we be receiving a recording of this webinar so I can share it with my colleagues so they can support students in this learning? Absolutely. So not only will you have access to this directly on your account here, but we also take the recording and we put it on our YouTube channel. And our YouTube channel has dozens of recordings of webinars and user stories and how-to guides to help you out. And so we will make sure to link the YouTube channel link as well when we send you a follow-up email with all of the links that we've provided in today's chat, so that you can pass this along to your colleagues, because sharing is caring. So we definitely want you to share as much as you can with your colleagues. So Faye, thank you for saying that. We definitely love Calibrate, and I think we've gotten pretty good at being able to get the information down in shorter bits and pieces. Cindy, welcome back.
Cindy, I did my best to channel you, but if you had other things you wanted to say, go ahead.
No, I think I finished it before my, the little mice that are running the internet today. No, just pick a few cases that you like and stick with them, and then add slowly to that, and then you'll build a repertoire before you know it.
Absolutely. That's perfect. Yes. Go slow. Don't feel like you have to take it all in at once. Right. And same with assigning your students, right? Don't give them everything.
No, they will get overwhelmed. Just, start with a case or two. One case a week is fine, because it's going to take them like an hour to do the case. So you have to figure that into their workload. But that one case can be very valuable, as I shared with my student who used those skills that he garnered through that case and applied it to the patients on the wards, the cases he was seeing. He said, oh, I'm seeing this kind of case. I'm seeing pneumonia, so let me do a pneumonia case. And then he applied those skills, those, clinical reasoning skills.
That's excellent. And Mimi had popped in the chat, getting started for faculty and administrators. So a great resource on just getting started to answer the question that I had previously posed. Let's see what else.
Megan?
Yeah.
Somebody asked, I think Dr. Weingarten said they're in charge of the surgery clerkship.
Yes.
And how does this apply to their students?
Yes.
So, I guess I would say, well, there's the partner group, which is the WISE MD, but you can actually go through and use your Aqueduct and use your dashboard and pull up surgery. So there are pre-surgical cases. There are a number of cases that really can relate to surgery. It's not like WISE MD, you can actually see surgical procedures, et cetera. But these cases are actually pre-surgical, which I would think that the pre-op care of a patient can be challenging for students sometimes. They just want to do the skill versus understanding, to admit, not to admit, surgical, non-surgical patient. So you can search for surgical and pre-surgical cases using the content library.
That's an excellent tip. And Dr. Sharma had suggested also setting up a curricular consult to kind of dive deeper into the specific needs of the clerkship and how we can better help the students. And
I would say for surgery too, Dr. Weingarten, is on the integrated illness scripts. So like there's one for an API. So many times, again, students get all caught up with wanting to do the procedure versus understanding the mechanism of disease, the underlying pathophysiologic insult. And the integrated illness scripts are really nice. You should take a look at them. And they actually have a tool in there. Like they have an MOD map, a mechanism of disease. It's like not completed, fill in yourself, or partially completed. The same thing with the UPI, the underlying pathophysiologic insult. You can have the student work on that. So they don't always need to be in the surgery. They may not be able to be in the surgery. So they could be doing this kind of work so they understand what those procedures are before they go participate in a procedure or the pre or post-op care of that patient.
Cindy, you say start with a few cases, but I am consistently amazed by your knowledge of all of the cases.
I think she's done all of them.
Amazing.
Again, I learn things too when I work here, so that's fantastic. We have another question on here. Are the clinicians who develop Aquifer FM cases the same people who develop the FM NBME questions? Do either of you know the answer to that?
So some are. Some of these people have been on NBME. There's a lot of crossover. People participate, but they're all active clinicians in their area of expertise. So you don't have somebody who's practicing who's a radiologist developing the questions for FM. So they are in their area of specialty, but many of them have served on NBME and other boards and part of LCME. So, the world is small where people participate.
Absolutely. Do we have any other questions today that somebody would like to ask? Let's see. Oh, there is one in the Q&A. Perfect. I think we're all excited about this.
Yes.
With Cindy.
Coming soon.
It is coming soon. Do you want to take that one, Cindy?
Yeah, July 1. So we're really excited. July 1 is the big time of the year for Aquifer. That's when they launch a lot of their new products. So last year was neurology, which was pretty exciting and was very exciting. And this year it's women's health. And I believe we're starting with 8 courses, 8 cases, which is great. But that's in addition to, remember, if you go into your content library and you pull down women's health, you're going to find stuff in peds, family med, and IM. It can be menopause, perimenopause. It can be a bleeding in a 20-year-old or bleeding in a 50-year-old. So there are other cases already within the Aquifer system that address women's health, but we are excited to launch the 8 new cases that are coming with women's health. And hopefully Calibrate will follow for neurology and women's health as well.
Mm-hmm. Yep, and we will continue to release cases as they come done.
They'll continue to add. I think they'll get up. They'll just keep adding, but 8's a good start.
8 is a good start.
And it's both women's, so it's OB and GYN. So it's a combination for total women's health.
Absolutely. So another, cases that you can add to the students' to-do list and create a custom course, which is good. Any other questions today? All right, I am not seeing any. So we'll wrap up this webinar. If you are interested in a curricular consult, I have posted the link into the chat. You can schedule a time to meet with a peer trainer or an Aquifer staff member, and we're happy to help you get started or help with any of your sticking points that you might have in your program. As you can see, these educators are very well versed in Aquifer and enjoy talking about it. So I know that they would be happy to meet with all of you. I will be sending out a follow-up email that includes the YouTube link to this webinar and all of the links that we provided in the chat today. And if you have any questions, you can definitely just feel free to reach out to us. So thank you both for presenting today. We appreciate your time. And thank you all for joining us this afternoon.
Thank you.
Bye.